Hi, my name is Brooke Chavaria, and I will be teaching this workshop on ovarian cancer risks and how to reduce them. First, I want to just give you an overview of what we'll be talking about in this workshop. Know the symptoms, we'll talk about the symptoms. Know the facts, we'll go over the facts. We'll talk about the risks, and we'll also talk about how to reduce those risks. So first, the symptoms. Some of the symptoms include abdominal bloating or swelling, quickly feeling full when eating or a loss of appetite, unexplained weight loss, discomfort in the pelvic area. Also, you can have some discomfort in the back, changes in bowel habits such as constipation, frequent need to urinate. Now, some of these obviously imitate other illnesses that are benign, so that's why we need to get to know our bodies and recognize when it's different, and then talk to our doctors about that and try to make sure that they give that some credence. Next, know the facts. 1 in 78 women will be diagnosed with ovarian cancer in their lifetime, and that's actually quite a bit. The American Cancer Society has estimated that about 21,410 women will be diagnosed with it in 2021. And they also estimate that around 13,770 women will die of the disease in 2021. So this just shows you how high that is. It has gone down quite a bit in the last 2 years, but it's still pretty high. Symptoms rarely show up in the early stages of the disease, which is why the death rate is as high as it is. And this is why we need to recognize the changes in our bodies and reduce our risks. Symptoms in later stages can also imitate benign conditions and be misdiagnosed. About 50% of women diagnosed with ovarian cancer are over age 63. This doesn't mean, however, that we don't need to watch for it earlier, because you can get it earlier. Now, some of the risks include, but are not limited to, family or personal history of ovarian, breast, or colorectal cancers. And when it says family history, it's really referring to 1 to 2 generations back. So look at your grandmother, your mother, your sisters, your father. Also, older age, especially after menopause, increases your risk. Inherited gene mutations, such as the BRCA1 and BRCA1 genes. Now, BRCA is short for breast cancer gene, and every person has these genes. The BRCA1 gene acts as a tumor suppressor, and it helps repair damaged DNA. And a mutation of one or both of these genes can make a person more prone to developing breast and ovarian cancers. And a man or a woman with a mutated BRCA1 or a BRCA2 gene has a 50% chance of passing that mutation on to their children, even if they don't actually develop cancer themselves. So it's important to find out, if possible, if your parents, grandparents have these genes, or the mutated genes. Also, a family history of Lynch syndrome, which is caused by inherited mutated genes. Now, these genes normally protect you from developing certain cancers, but mutations stop them from working properly. This is also the most common cause of hereditary colorectal cancer, which is also puts you at higher risk for ovarian cancer. And people with Lynch syndrome, they're more likely to get different types of cancers, including ovarian cancer, before age 50. So that's why we don't need to just worry about it later in life. There's other factors that can cause us to get it earlier. Estrogen hormone replacement therapy can also increase our risks. Now, there is estrogen-free hormone replacement available for those who need it. No births or full-term pregnancies can also increase those risks. So not giving birth or giving birth later in life can make that higher. Smoking, as well as obesity and a poor diet, those are all factors that have been known to increase your risk of cancers, including ovarian cancer. Now let's talk about ways to reduce those risks. Obviously, some factors that increase our risk can't be helped, like inherited bad genes, but some of them can, and so here are some ways that we can try to decrease our risk. One is oral contraceptives. Studies show that oral contraceptives can actually reduce your risk, and the longer you're on them, the more that risk goes down. Also, IUDs, the intrauterine devices that are used for contraceptives. Estrogen-free hormone replacement. Like I talked about before, most women will need hormone replacement after the menopause and sometimes after other procedures, but estrogen-free therapy is a better choice. No smoking. This is something that will obviously help our overall health as well as reducing the risk of cancers. Maintain a good weight and eat well. So trying to reach and maintain the healthiest weight we can will help our chances of not developing cancer. Screenings for gene mutations. Although we won't be able to change if we have those inherited bad genes, this can be a motivation to be vigilant about doing the things we can to keep ourselves healthy and to reduce the risks that we can control. Regular women exams, these may and may not be helpful in finding cancer early on, but if there is a mass big enough for them to find, a pelvic exam could be what finds it. So it's important to regularly go into for those. Also, the pap smears can show levels related to cancers or pre-cancer, so it's really important to get those. Tubal ligation, also known as getting your tubes tied, is helpful in reducing the risk, as well as the removal of your ovaries and fallopian tubes. Now, I'm going to hand out like a risk assessment worksheet, and we'll go over it. Let me just go over the questions on it first, and then this could be a personal thing, or if you want to share it, that's fine, and that way we can help talk about some of the things to reduce some of these risks. We ask your age. This is important because the older you get, the higher your risk. Do you have a personal history of breast cancer before age 40? Do you have a personal or family history of ovarian, fallopian tube, or primary peritoneal cancer in a first or second degree blood relative, like your mother, your sister, your grandmother, your aunt? Do you have a family history of hereditary non-polyposis, I can't say that word, polyposis colorectal cancer or Lynch syndrome in a first or second degree relative? In the past month, have you experienced one or more of these symptoms daily for at least 2 weeks? Bloating or sudden weight loss, pelvic or abdominal pain, urinary frequency, indigestion, or feeling full quickly after you begin eating, or pelvic pressure? Do you have a personal or family history of a BRCA mutation? Do you smoke? Have you ever given birth? Have you gone through menopause? Do you use estrogen hormone replacement? Have you ever used oral contraceptives? And if yes, how long? So we'll fill these worksheets out and we'll come back and discuss them, discuss ways to customize our plans in order to reduce our risks, and then talk to your doctors about ways that you can personally, if you have any of these issues, if you want to get your screenings done, this is a great start to do that. Thanks for attending my workshop, and I hope you've learned something. Goodbye.